Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good morning and welcome to Ethical Perspectives on the News. My name is Diehl. I currently serve on the Interreligious Council of Linn County and also am the Vice President of the Humanists of Linn County. As most people know by now, the decriminalization and legalization of both medicinal and recreational marijuana has spread rapidly across the United States over the last several years. To date, there are now 31 states, Washington, D.C., Guam, and Puerto Rico, that now have comprehensive public medical cannabis programs. In addition, there are now 9 states that have legalized the use of recreational marijuana and 13 other states that have decriminalized its use. On this morning's show, we'll be discussing marijuana in Iowa. Good morning.
Morning.
Well, here I have with us a distinguished panelist, panel of guests, and I'd like each of you just take a few seconds to introduce yourself, tell us a little bit about what you do and why this is important to you.
Thank you. My name is Kimberly Loeffler. I am the owner of Corner Store Apothecary and more, and we sell hemp products, CBD products. Have been very beneficial to the community here, and we like to go out and educate the community on cannabis.
Excellent.
And I'm Cody Crawford. I'm with Area Substance Abuse Council. I'm a prevention specialist there. I do a lot of community outreach, talking to adults and kids alike regarding several different substance use issues as well as mental health. This to me is important because there's a lot of information, there's a lot happening surrounding marijuana, surrounding CBD. A lot of information out there, some good, some bad, so it's just trying to help people hash through so they can figure out where they stand.
Yeah, very important. Definitely.
My name's Lucas Nelson. I'm the lead consultant for Medpharm, Iowa, which is the state's first medical cannabis manufacturer, and we also hold 2 dispensary licenses as well.
Excellent. Well, again, thank you. And we're kind of entering, some uncharted territory here in the United States, and certainly here in Iowa. And I think, Lucas, your company is really at the tip of the spear here when it comes to specifically medicinal cannabis. Talk again just a little bit more about what Medpharm does when it comes to medicinal cannabis.
Sure. So we are the state's first licensed manufacturer. We won that license back in November of 2017, which means that in just a few short months, we'll be the first company in the state producing medical cannabis products, and we'll have those on the shelves of dispensaries across the state here around December 1st. We're really at the heart of everything we do. We're really driven by science. We are everything from the way we're growing to our plants, the way we're formulating our products. Every single thing is driven by what we know from scientific literature, what we know from research. We really think that it's important to use science as the basis for the program here in this state, really make sure that Iowa gets set on the right path and remains on that path as this program develops.
Yeah, so there's, as I was kind of preparing for this show, there definitely seemed to be, even in my mind, but as I talk to different people, confusion around, the difference between, even the difference between cannabis and marijuana. Are they different? Are they the same? But certainly confusion between medicinal cannabis and, recreational cannabis. So maybe you could talk, and I'll bring Cody and Kim in here shortly, but talk a little bit about what makes medicinal cannabis unique from, traditional recreational marijuana.
Sure. So medicinal cannabis here in this state really is going to, at least at the beginning, be focused on 2 of the molecules from the plant, which are CBD and THC. CBD is one of those molecules that people may have heard a lot about as far as helping seizures and that sort of thing. A lot of people know about THC as well. Those are the 2 compounds that we're really going to be focusing on here at the beginning. Medicinal cannabis products in the state right now will include oral forms, they'll include topicals, they'll include suppositories. What's really important to note is that here in Iowa, we're not permitting any sort of smoking, any sort of edibles. Those forms are not allowed. I think there's been some confusion around, well, is that something that we can have in this state? Can people smoke? cannabis and that sort of thing, that is not going to be permitted under our state's program.
And what is the rationale behind that?
You know, I think with the edibles, it's probably at least partly driven by some fear that they could be attractive to children, that they can fall into the wrong hands when they're not supposed to, obviously. There's also can be some potency issues there. They can have a little bit longer onset of effects, which then can lead some people to taking more than they probably should. Smoking obviously has plenty of harms. When you're inhaling a smoke, there are some carcinogenic effects and that sort of thing. So I think our legislature was really focused on not getting down that path at this point, and really wanted to focus more on at least close to pharmaceutically derived products, and that's what we'll be making.
Yeah, very good. Now, Kim, with your, you're dealing with potential consumers of this product, and with your store. Maybe you could talk just a little bit about what got you into this, kind of sold you on the benefits of cannabis. Maybe talk a little bit about that, and then we can get into what you're hearing from your customers.
Sure. Well, a few years ago, my husband, I was at work at the university. I left work because I got a call. He was in the emergency room. My husband has never really had seizure activity or anything like that, so they weren't sure if he had had a seizure or if it was a heart condition. So they had hospitalized him, and still weren't sure. He had a couple seizures overnight in the hospital. They put a loop monitor into his heart because his heart would stop. So within 1 week's time, they had over 4,000 episodes of his heart dropping to the low 30s. After that, several different times, he had seizures again, so they weren't really sure. So they put in a pacemaker to make sure that if he did have a seizure, that his heart would not stop. A couple times before they had actually got the pacemaker in, his heart had stopped. 18-second pause was the longest time. So we've almost lost my husband several times. By the grace of God, we're still here, and he's here. Going through several medications. He was on so many different medications for his seizures. They were just debilitating for him. I had to take a leave of work of absence from work, and he did as well, until we could figure out what was going on with him. After going through the Mayo Clinic, determining it was actually the seizures causing the heart problems, not the other way around. He was diagnosed with epilepsy. So that's when we went through all these medications, all sorts of different side effects, horrible, horrible side effects. We've even seen children that were very young on the same dosage as my adult husband. They were lying in fetal positions. I, as a nurse, should have known that them lying in fetal positions, I thought it was from damage from the seizures and things like that. It was actually from all the medications that they were on, same as my husband. Just like my husband, when these kids were off these medications and started on CBD oils and that, and then eventually adding THC to them as well, they're walking, they're talking. I have my husband back. Better quality of life. I could not go back into nursing knowing that there's a better way out there without these doctors just writing scripts.
Yeah. No, it's a powerful story, and as I was mentioning earlier, as I was researching for this show, I mean, there's a lot of stories out there of how cannabis, in different forms, has treated all kinds of different diseases and epilepsy and just chronic pain, so on and so forth. And it seems as if a lot of legislation in different countries. I think there was a particular documentary I was watching in Australia where it was just one individual who had just kind of this. Cannabis basically saved his life, right? And just that one person, that kind of spread throughout the country and drove change when it came to the laws in that country. And so the point of that is that the stories such as the one with your husband do resonate with a lot of people.
Absolutely.
And on the flip side of that, I've also talked to people that have fears about, they talk about their own personal struggle with drugs, with in all its forms, and they advocate against it, right? But because it's very personal to them. So I think this kind of goes back to how anecdotal stories can be extremely helpful, but sometimes they don't paint the whole picture, right?
Sure,
Like I don't think we should necessarily, take too much stock in either one of those positions. But at the same time, they're very, very, very important part of the discussion, which kind of gets back into what should we be looking at when we're thinking about forming new laws around cannabis. and I think part of that is the research around it. And one of the things that you do, Cody, is go around and talk about where are we at with that, right? And you educate people on it. Could you just talk a little bit about the research around this, the laws around both medicinal and recreational cannabis, specifically here in Iowa?
Yeah, absolutely. And I will second that the discussion tends to come together when you're talking about retail marijuana and medical CBD, and they are two very, very different things. The research surrounding it, there are a number of research studies out there. The part where I struggle when looking at it is a lot of these studies, they're small numbers, they're short term, they're not double-blind studies that every other medication in the United States goes through. So they are being used and advertised as medicine, but they're not regulated as medicine. The Iowa program is a little bit different because there are regulations in place there. But with that then, rather than going through the standard process of any medication going through the FDA process, we've instead had elected officials who are not medical researchers, are not medical professionals, make this decision that this is a medicine. And that's where I struggle with, especially on a personal level, having an elected official decide what is good for me medicinally or good for everyone medicinally. And there is anecdotal, I see everyday anecdotes. Yours is one of the more powerful that I've heard. And that is the struggle, like you were saying. It's hard to look at someone and it has changed their life and say, but it hasn't gone through the process. But at the same time, the process is there for a reason. So there are a number of studies out there, that's undeniable. There's some here in the US, there's many more internationally. It's difficult to do here in the U.S. because of the way the federal system is set up. It's hard to get your hands on the proper plants, if you will, the proper derivatives to do the studies that need to be done. And there's been some look at the federal level on that. Not a lot has changed. But when I'm looking at it, to me, that's a better approach to it than going to legislators and saying, let us use this, because they're not the experts.
Yeah, no,
Absolutely.
I agree. And so it's identifying the experts, right, and getting good studies completed. And there has been some, to your point, there definitely has. But I think we talked about earlier, probably not to the level and the robustness that we would like to see around a prescribed medication like that, similar to others. Do we feel like medicinal cannabis is more prone to abuse than maybe other prescription drugs? I mean, there's a lot of emphasis on illegal drugs, but obviously we've heard, that prescription drugs oftentimes get more abused than others. Do we feel like there's less of a risk with medicinal cannabis as it related to other maybe opioids and prescription drugs that are out there? Is that one of the benefits, or is there risks that we need to be talking about? And this is for anybody. And feel free to chime in. And
I think one of the most interesting things we've seen is that in finding ways to educate physicians, we've gone out and sought out experts, doctors who have treated patients with cannabis, with medical cannabis for long periods of time, and we've talked to researchers in places like Canada that now have a much bigger program than the U.S. does. What we've seen there is that the safety profile, especially of CBD, but even of medical cannabis, what they're finding is that often it can be much safer than opioids. Opioids has a much shorter time to dependence than cannabis does. For that's one of the many reasons that some doctors are now looking to say, okay, how can we start tamping down the level of opioids we're providing to someone? Can medical cannabis and opioids work in conjunction? We see in research that there actually seems to be an effect there where you can bring down the dosage that you're using as far as an opioid, and mixing that with medical cannabis really can help people start to wean themselves off. At the same time, that is not true for everyone, and I think that's one of the things we've got to continue to focus on, is that what we're advocating for is medical cannabis being a tool in the toolkit. It is not necessarily going to be right for every condition. It's certainly not going to be right for every person. There's obviously people out there with mental health issues, with poorly controlled heart conditions, those sorts of things. Our products that we'll be selling actually are going to be contraindicated for those sorts of conditions. So it may not be right for those people, but I think we need to work on the laws in this state to make sure that we do have a program that for those who it may benefit, at least it's set up to do so for those sorts of people.
And Cody, I feel like you have a unique perspective on
Yeah,
this
and
too, with ASAC.
to me, a couple of different points. Number one, I think the way the system is set up in each state will affect how it's seen, how it's portrayed, and how it's abused in each state. Iowa, for instance, limits the THC level to 3%. THC is the portion of cannabis that is addictive. So CBD is not an addictive component of it. So you can have what you need for CBD, but THC is the limitation. If you look at states that have had programs in the past, looking at, say, Colorado or Oregon or Washington, that had unlimited THC on their medical CBD, you did see abuse. There are numbers out that 80% of all scripts went to people who complained of untreatable pain, the kind of generic untreatable pain. And if you look at the demographics, it does not fit the standard demographics of someone who lived with untreatable pain.
Right. So a younger demographic, I assume.
Yeah,
right.
younger demographic.
Yeah, go ahead. No, you're fine. Keep going.
So there is that possibility. I think the way Iowa's is set up, I don't necessarily see that possibility, because with the limitation on the THC, there really isn't even enough THC to cause a high.
Right.
So if someone uses it as a drug, they're really kind of throwing their money away, to be honest. It's not going to do that. And I did just want to say to one point that Luke has made with regards to the opioids, I will agree there are the studies out there that show using them in conjunction, it can help. The problem is there are also studies out there that show that the addiction rates can go up. If you look at states that have legalized recreationally, opioid numbers actually increase dramatically. Opioid deaths, excuse me.
Are we talking about
overdose
recreational
deaths.
or medicinal? in this
Both
case?
recreational and medicinal.
And medicinal. There's no distinction. In when
In
it
the
comes
numbers
to
that I
addiction.
have seen.
Okay.
Maybe there's some out there that do distinguish, but from what I have seen, there has not been a distinguishment. But the opioid deaths have actually increased after that point.
I think we do, at least some of the research we've looked at, there seems to be a lot of confusion around and really conflating between medical, recreational, legal use of opioids and illegal use of opioids, illegal use of marijuana and other substances. Again, too often I think we're, in this state and across the country, conflating all of those together and saying because illegal use of marijuana leads to at least an increased likelihood of increased use of opioids, then we shouldn't have a medical cannabis program at all. And our position is that is absolutely not the case. While that may be true on the recreational side, and certainly that's something that our legislature and other stakeholders in the state need to be looking at, when we're talking about the medical cannabis program in this state, we need to separate those two things and worry about the end result is trying to obtain symptom relief for certain patients, and how do we best set up a program to do that. Unfortunately, our program is not perfect. The 3% cap actually is one of our biggest issues. I think to sum it up in the quickest way, and of course we can go into this more, but the problem is that 3% cap is on the actual products. And what we're all used to doing is looking for a certain dose of a medicine that we need. For patients that are using THC and CBD, but here we're talking about THC, to treat their conditions. For instance, let's take an MS patient who needs 35 milligrams of THC. That dose doesn't change every single day. That's the dose they need to treat MS. Well, at 3%, it's going to be much harder to obtain that dose because they're going to have to take more 3% pills or more 3% drops of tincture oil. I think there's a better way to do it. I think capping the amount of actives that someone can get, so how much THC can someone purchase at one time, and not allowing them to buy any more until that supply has run out, or until a certain time, what I should say is until a time period has elapsed. We think that's a better way to get at it, because again, at that 3% level, you're asking someone to take maybe 5 pills or 6 pills or 7 pills instead of 1 or 2.
Right.
And of course that drives up the cost for this too. Those are the things we should be looking at in this state to really set us on that right path.
Yeah. So this is kind of a segue in. We got about a little less than 10 minutes, kind of moving towards recreational marijuana. The 3 letters we're focusing on here, I think, is THC, right? Which is what people, lack of a better term, crave or desire when it comes to marijuana, the associated high and the feeling of euphoria and whatever, the different chemical come. chemicals give you. But I would like to get just an initial reaction from each one of you when it comes to recreational marijuana, and that is, if somebody says recreational marijuana is really never harmful, what's your initial reaction to that statement, or what would be your initial reaction to that statement? Start with you, Kim.
As far as recreational not being harmful, I say yes, it can be. I mean, there's no use for a child to be using any type of that, THC substance for recreational use. Medicinal use is different, and that's what I kind of wanted to touch on real quick with the THC and the CBD that they were talking about. Everybody is so worried about people using medical cannabis to get high, and that's not what this is.
Right.
My husband has oils. He has one of the cards. He was one of the first, 98 to have one here in the state of Iowa. Even at that time, he could possess the card. There was nowhere to get the oils.
Right.
So we had to go out of state and get oils that were comparable to him. But that's just a misconception, and that's what I do, is go out and educate, and that's what is out there for us, the first and foremost education. I work closely here with the hospitals in the area, doctor's office, pain clinics, and opioids is one of the biggest things that we have been combating. We have one of the pain clinics here sending patients down that they are trying to wean off opioids. We have seen a tremendous reduction in people with their medications, weaning off medications with the help of their doctor. And this is just the CBD. So the THC, what that comes into effect actually is people can use CBD as a daily supplement and get the benefits. It's when those people have more chronic afflictions that need higher doses of CBD is actually where the THC comes in. That THC is more of an accelerator, helping that CBD accelerate and bind to the CBD receptors. So those people with afflictions don't have to take larger doses of CBD. So the THC itself is just an aid. It's just a catalyst.
Right.
It can also be an antagonist. But in this point of a recreational versus medicinal, yes, recreational. I'm saying no, a child shouldn't have, just like they shouldn't have any other drugs or alcohol and stuff until they're old enough, until their brain capacity and things like that are functioning. But that's the misconception, is the medical and recreational.
Sure, absolutely. No, and it is often construed and conflated. Cody, what's your response to that question or that statement?
My first response would be you need to do a little more reading, because to say it's never harmful is you're making an effort to actually believe that statement, because there's way too much evidence out there showing that it is harmful. My second reaction to it is to the term recreational marijuana. I take a little bit of umbrance to that, because there's nothing recreational about it. It's a drug. It's retail marijuana. It's there to make money. That's the only reason that section of it is there.
I'm interested. So with ASAC, I mean, you're dealing with people with all kinds of addictions and abusing all kinds of drugs. And what do you see at ASAC specifically? I mean, what are you seeing how is marijuana being abused? And what are some of the dangers associated from where you see it?
Well, I can tell you in our youth treatment program, marijuana is the #1 drug that kids come in as their primary drug of abuse. Alcohol and marijuana kind of bounce back and forth right now. Right now it's marijuana. But really it comes down to the side effects that I'd like to think we all know. It as you were talking before, your brain chemistry. As a child, your brain has not formed, and it does change the brain chemistry. It changes the way it develops. It actually goes to, there's studies out there showing that it lowers IQ points on a permanent basis long term. There's the short-term effects of your heart rate increases. When you smoke marijuana, there's obviously the smoking side effects, the carcinogens. It delays reaction time. You just can't use your body in the same way, similar to any type of drug, which then comes down to the side effects of drug driving and people who are high, whether they're at work or whether they're on the roads, becoming dangerous to people around them.
Yeah, and THC, again, the levels of it and the way, from what I saw, the marijuana of, again, retail or recreational, however you want to refer to it, to distinguish it from medicinal, is not your grandmother's or your grandfather's, that it is more potent. There's all these different strands, and it's becoming big business, and we're catering to consumers, so it's constantly changing, and there's demand for higher levels of THC and lower and whatever. So, there is danger with that, right? Like, you don't quite know, especially if you're a younger person or just a person that's not in the know, as to what you might be putting into your body, correct? Not even to mention whether it's laced with some other drug.
Yeah, when people think of marijuana, most often what we kind of get is the idea of the 60s and 70s, the counterculture. That's not what retail marijuana is anymore. Back in the 60s and 70s and even into the 80s, 3% was pretty potent marijuana, 3% THC, what we now look at as the cap for medicinal. Now, with different hybrids, with the chemists coming in with retail marijuana, you're looking at closer to anywhere from 10 to 20% THC potencies. In smoked marijuana, in the concentrates that you're getting now, anywhere from 50 to 70%. Wow. You can buy products that are 98% THC. Yeah. I mean, it's a very different world. And then when you're talking about the edibles, like you mentioned before, it affects people in a very different way. When you smoke marijuana, there's an instant high, and that's what people kind of know, what they recognize. With edibles, when you eat them, number one, the concentrations are massive. For instance, there's products in Colorado that are gummy bears, they're gummies, and they're 10 servings of THC. Yeah. Well, you're not going to eat 1/10 of a gummy bear. But on top of that, it takes time for your body to digest it, for it to really take effect. So people will eat a gummy, think it hasn't taken effect, eat more, and that's, you start to see poison rates go up, you start to see psychotic breaks go up.
I think this is why education is so important.
Right. Absolutely.
Something we're doing in our dispensaries, because I think what we've been consistent about since we got into this, is that abuse of this system here in Iowa helps no one. It doesn't help patients, it doesn't help the doctors who are certifying conditions, it doesn't help legislatures, or the legislature is trying to figure out how to go about making this program work. And to that point, what we're going to be doing in our dispensaries is taking our patients through very, very detailed titration schedules, telling them basically, here's where we recommend starting a 5 milligram dose once a day at night, so that you're not hopefully out on the road. And in fact, we'll have warnings that will accompany all of our products that will say, this is not something you should be doing while driving. And then if people need a little bit more dose, if they're not quite getting the effect that they need, then there'll be a schedule for when you should build up from there. Maybe it's 5 milligrams twice a day, and then maybe it's 10 milligrams once a day. And those are so important because I think, to your point, for those that just kind of walk into a dispensary and maybe don't get any of that information, there is a greater potential for abuse and issues, and we don't want that to happen in this state.
Well, there's so much to talk about. We could go on and on forever. I do want to ask you a yes or no question to finish the show, and that is, put on your looking into your crystal ball. In 10 years, is recreational or retail marijuana legal in Iowa, yes or no?
In 10 years, possibly.
Okay.
We're following the trend that it's going there.
Okay.
I'll say no.
All right. Well, again, I thank you for joining us, and I hope everybody enjoyed and appreciated this morning's show. We hope you have a great Sunday. Thank you, and join us again next week.